Before we move on, let's take a look at some S3 and S4 issues, okay? First and foremost, what does S3 mean to you? S3 is always going to take place after S2. And that's nice because chronological order. So take a look at the picture down below, and you'll notice that there is a little red line with S3. You see that? And that S3 right there is following your S2. What's happening? What is exactly happening here? Well, how are you referring to S2 as? S2 is a diastolic heart sound, right? Because you just closed your aortic and pulmonic valves during diastole. And in the meantime, what happens afterwards? The mitral valve opens and blood is gushing into left ventricle. Are you picturing this? You have to picture this in your head, or otherwise it's just a bunch of words that make no sense. So all this blood is rushing into left ventricle during diastole. The mitral valve has opened, and if that left ventricle is too large, as it may occur with pathology such as congestive heart failure, could it occur physiologically? Sure. Really? What kind of patient? A patient that is an athlete, well-conditioned athlete. Isn't their heart a little bit more efficient in terms of increasing preload and having increased contraction? That's why they're athletes. They're able to properly have enough blood and oxygen being supplied to the skeletal muscle. So, Dr. Raj, you're telling me that S3 could be found in normal individuals? That's exactly right. Who are these individuals? Athletes, maybe pregnant ladies. What happens to plasma volume in a pregnant woman? It increases up to as much as 50%. That's a lot of volume in your plasma, I'm telling you. And what may then happen to left ventricle? Well, that left ventricle might then become overwhelmed with fluid during diastole, and you may create an S3. I hope that's clear. So it could be found normally in children for the same reason, athletes, reasons we just talked about, and pregnant women, and S3. However, in the United States, a 35-year-old who's obese, you're in S3? Oh, no, that's a pathology. You're thinking about left ventricular dysfunction, a systolic dysfunction. That's what happens with congestive heart failure. What's the most common cause of congestive heart failure? I know I'm throwing a lot of information at you, but that's okay, because this is how you're going to learn. You're not going to feel overwhelmed. You're going to take what I'm telling you, and you're going to digest this. And trust me, anything that I've been talking to you about throughout this entire lecture series, it's not the first time that you're going to hear it, nor is it the last. Guarantee you're going to hear this 100 different times. So congestive heart failure, the most common cause would be a myocardial infarction, would be an ischemic event, therefore causing death of the myocardium, resulting in perhaps congestive heart failure, resulting in what kind of dysfunction? Systolic dysfunction. Are you with me? Good. Now, is it possible that you might then create an S3? Of course. Take a look at that chest x-ray in your head with congestive heart failure. Tell me about that apex. Where is that apex? It's not where it should be. It's not at the midclavicular. It is lateral displaced. You feel good? I hope so. Is this information setting in? It will. Have faith. Let's continue. There's athletes. S4. S4 is a little bit of a different story. All right, let's regroup. So S3, could it be found in normal individuals? Yes. When do you hear S3? After S2. What is an S2? An S2 is a diastolic heart sound. What happened at S2? Closure, closure, closure. Closure of whom? A2P2, A2P2. Followed by mitral valve opening. Left ventricle is too large, you create an S3. What about S4? Take a look at the bottom picture. You have an S4. Where is it? It's before S1. Okay, regroup. Tell me about S1. S1 is a systolic or diastolic heart sound. It is a systolic heart sound. How do you know, Dr. Raj? Because during systole, you have closure of the mitral, followed by closure of the tricuspid, right? Welcome to S1. What happened right before S1? What happened right before S1? It's the fact that you're at late diastole. Think about this. I'm asking you what happened at the beginning or right before closure of that mitral valve. Late diastole. At late diastole. What does that mean to you? Atrial kick. Right? The SA node, boom, depolarized. The atria kicks. This is part of diastole. Is that clear? The atria is going to kick. It's actually part of late diastole. It's kicking the blood into left ventricle. Okay? But what if the left ventricle is thickened? What if it's stiff? Like what? There's something called hypertrophy. You've heard of that before. You've heard of hypertension. You've heard of that before. That's a lot of pressure on your left ventricle. And at some point, how is that left ventricle then going to respond physiologically? It's going to go through an adaptation process. What's that called? Hypertrophy. What kind? Concentric. We'll talk about this, not to worry, over and over again. A concentric hypertrophy is when the sarcomeres are going to duplicate in a parallel. Okay, why? In this case, it's pressure overload. What caused that excess pressure? Hypertension being the most common. Later on, we'll talk about aortic stenosis. But hold on. Let me just give you what's happening with S4. So here's hypertension. Huge problem in the U.S., metabolic syndrome. What's the cutoff point for hypertension? 140/90. Our discussion earlier took place with the difference between urgency and emergency. Do you remember that? If you haven't, make sure once again you go back and review. Do you see? It's not that the information is difficult. It's the volume of information. And so therefore it is important that you keep going back and review. Trust me, it'll work out. Trust me, it will. Just stick with me. So with all that pressure taking place in left ventricle, undergoing concentric hypertrophy, a thickened left ventricular wall. Tell me about the compliance of this left ventricle. Take your time. Tell me about the compliance. It is decreased, right? Decreased compliance. What does that mean? It's become stiffened. Now, during that kick, the blood is having a hard time getting into the left ventricle. What are you going to create? You're going to create an S4. Look at the term and bold it here. Always abnormal, S4. What does it mean? Indicates a stiff left ventricle. Example, hypertension. What's another one? A pressure type of overload on left ventricle, aortic stenosis. What kind of hypertrophy? Concentric. What does that mean to you? The sarcomeres are duplicating how? In parallel. Causing what? Narrowing of the left ventricle. I'm going to take you one step further. You ready? Of course you are. You were born ready. So that left ventricle and thickening. This is a diastolic dysfunction. That chamber becomes very small. And if that chamber becomes very small, you can't fill it up during diastole. Is that clear? That's a diastolic dysfunction. What then happens to left atrium, please? You see that last line right here? It says dilated what? Left atrium. How come? The left atrium is having a hard time kicking left ventricle. Therefore, left atrium is going to do what? It is then going to get dilated. So what does S4 mean to you? Always pathologic. What does it mean to you? It means that you have a stiff left ventricle. Now, is it possible for you to have congestive heart failure in which blood remains back in left ventricle? Think about what I'm just saying. Congestive heart failure, you have a dying heart. Blood then remains back in the left ventricle. Are you with me? So you're creating what kind of issue? You're creating an issue where the blood is contributing to stiffness. So could you have an S4 with congestive heart failure? Sure you can. That's not a good sign, though.